Okay, so that wraps up our introduction. It's my absolute pleasure now to hand over to Kevin Yin, Regional Medical Expert, Influenza for Sanofi, Asia and JPAC. He will be talking through the influence of influenza. And we will now hand over to Kevin.
Thanks, Dan. Can you hear me well? Can you hear me? Okay, I assume that yes. Thanks for the opportunity to present to you some of the basic background for flu. Now, as we know that this is the short term for influenza, and indeed this is the Italian word for influence. So that's where the name came from. It has been documented for more than 500 years now. It's a viral disease so caused by flu viruses. And you can see in the graph, it is much more severe than a common cold. So we need to be clear the differences between the flu and common cold. There are two different diseases caused by different viruses. In terms of the symptoms, the onset of the flu is much more accurate, much more acute. So it came out quite suddenly compared with the common cold is a slow start and less severe. Fever is much more common for flu compared with the common cold. And when you have the flu, some people would say to you that it feels like being hit by a bus. So you have the aches around your body, muscle ache, joint aches. This is very common for flu, but much less for common cold. And also, it's another common symptoms for flu is chills and fatigue. I recall my last episode for flu back to 10 years ago. When I had the episode for flu, I was literally lying on the bed for 2 or 3 days. So such a severe extent. Next slide, please. So how common is this? Now, based on the modeling studies, we have read it's about 1 in 7 the world population have the flu each year. So it's about 1 billion cases each year. Most of them is not that severe, but about 3 to 7 million cases, they are severe cases. It means that when they will need to go to the hospital, ICU, and some of them, they die from the flu. Now, I would stress that the 3 to 5 million cases for severe episodes, this is substantially underreported. So what happened is when someone got a severe form of the flu, they will go to the hospital, go to the emergency. They will present with other symptoms or presentations like pneumonia, heart attack, stroke. So those are the presentation the doctors are seeing. Now, when you are doctors in the hospital, in the emergency room, seeing something like this, the first thing you want to ensure is the patient survive from the infection. Most of them, they do not test the patient for flu. And that's why a lot of the severe cases are not identified. Therefore, what we see is what we looked. It means that we need to do more testing to find out the true burden of the influenza. Next slide. Now, this is the video I would like to share with you. It's my former PhD supervisor, Professor Robert Boyd from Australia. He will tell you how the disease is spread.
Public transport isn't the only place. I want to show you how extremely contagious the flu virus is. Look at how many people.
Can you guys hear the sound or not? Let's try again.
Are touching the same surface. And just imagine for a moment how many people have already touched it and how many more will. You can catch the flu in a lift, at work, in the kitchen, even at the movies. Any place where a lot of people are passing through. The flu is a highly contagious disease. It's spread by people coughing and sneezing or by contaminated surfaces. When you catch the flu, you can feel awful for days, like you've been hit by a truck with a fever. You just can't get out of bed. But even more concerning is that you can pass it on to vulnerable people, to little babies, to pregnant women, to people with chronic medical conditions, and also to the elderly. Public transport is the perfect flu and cold incubator.
I realized the sound was not projected. Let me try again.
The movies, any place where a lot of people are passing through. The flu is a highly contagious disease. It's spread by people coughing and sneezing or by contaminated surfaces. When you catch the flu, you can feel awful for days, like you've been hit by a truck with a fever. You just can't get out of bed. But even more concerning is that you can pass it on to vulnerable people, to little babies, to pregnant women, to people with chronic medical conditions, and also to the elderly. Public transport is the perfect flu and cold incubator. Look at how many people are touching the same surface, and think about how many more will have touched it before and after. All it takes is to come along, touch that surface, then touch their nose or later rub their eyes, and the virus can be transmitted. When the flu virus gets into your body, it penetrates cells in your respiratory tract. Once there, the virus can replicate itself in one cell, then many, and it gets a foothold in your lungs, so that when you sneeze or cough, the virus can exit your respiratory system, a great way to spread themselves around. The flu virus mutates regularly, and that's why we have to have a new vaccine every year. But it's also why the flu on average is much more severe than the common cold.
I hope this is clear enough. If you could turn to the next slide, please. So that was how the disease is transmitted. In terms of the disease cause, well, we all start with the infection with the virus. Patient would take 1 to 4 days before they show symptoms. And depends on your individual, the symptoms can last for 2 to 7 days. Now, I think quite important is you can be contagious or infectious before you have the symptoms, as you can see from the slides. So it's quite important that you need to be aware before you have symptoms, even though you just feel a little bit unwell, be aware you might have the flu, you might be passing the virus to your loved one. So be careful with that. So how the virus are transmitted? Now, it's similar with the COVID-19. It's mainly an airborne disease. So come out with your droplets when you cough, when you're sneezing, contacts, shake hands. I hope that you're not doing this anymore. And the environment, like the tables, the service, the patient touched. So be careful with this. The good thing is most of the patients, they do recover. Although some may take longer, like the elderly or those who have medical conditions, they may take longer. Now, unfortunately, not everyone recovered. Those who do not recover means they die from the disease. Next. Next slide, please. Now, the other thing I want to stress is when you compare with common cold or other respiratory disease, flu is a more severe one. It's not just the symptoms, it's also the complications. And again, this is one of the key differentiation factor compared with the flu and other respiratory viruses. I would not go to details, but the evidence and literature tell us that flu can trigger heart attack, so myocardial infarction, pneumonia, viral or bacterial pneumonia, worsening of asthma or diabetes. So be mindful, this will be the severe complications, the severe form. And that's why people may not realize this kind of severe condition, they actually are triggered by flu infection. And that's why they do not test them. And we do not see as many cases as we should have seen. And patient may have increased risks to go to the hospital, ICU, or even died from the disease. So be mindful, flu is a severe disease when they present with complications, and that's where the patient will suffer most from the infection. Next slide. So what are the kind of high-risk groups? So who are the people who would have a higher chance to develop these complications? The World Health Organization, they identify several groups like pregnant women, healthcare workers, young children under 5 years old, the elderly, meaning 65 and above, or people who have medical conditions like heart disease, lung disease, diabetes, or asthma, so on and so forth. Now, among these groups, the most important one for vaccination is actually the pregnant women, based on the World Health Organization, because when you vaccinate pregnant women, the woman, you do not only protect the adults, you also protect the fetus or the newborns in the future. So those are the important groups identified by the authorities. The WHO also recommends the countries should decide what other groups should be prioritized for vaccination. And that can be based on the disease burden, cost effectiveness, the feasibility of the vaccination program, and other considerations. So the actual groups to be recommended for vaccination can be different between the countries. Next. Now let's go to one of the groups I would like to share with you on this slide. For those who are parents who have children, I am sure you will agree with me that the children, they share everything except for toys. Means that they share the virus, they share the pathogen with you, and I would call them the bioterrorists. Now, you may not agree with me, but what I would try to highlight here is how the children is why they are called super spreader. The graph you see here is the graph from Australia, where they show the rates of the hospitalization for influenza by age group and by time period. So you can see quite clearly, those under 5 years on your left-hand side, they have much higher bars, and which means the much higher risks to go to the hospital for the flu. Now, to be fair, most of them, they will got discharged quite quickly, and most of them, they would survive from it. Most of the death is actually happening in the elderly group. But I guess the important point here is when you go to the hospital, even they discharge the second day or the third day, they consume the healthcare resources. And that's why it's important to make sure that children are protected, so do the other age group, so that we can save the healthcare resources for other diseases which are not vaccine preventable. The next slide. And it is not just the healthcare cost, healthcare burden. If you look at the money side, because the people, when they're sick, go to the hospital, go to the GPs, and they may ask for medical certificate, time off work. And actually, for Asia and other parts of the world, the flu actually is a significant part of the economic burden. Think about this: if someone go to hospital, get admitted, how much money you pay for this episode? And it's not just one. As I told you at the beginning, it's quite a common disease. Not to mention, if you are working, when you are sick with the flu, you need to ask for time from work, not just because you are sick, you need to rest, but also because you do not want to spread out the disease to your colleagues. So this is some of the numbers. They would say 1.5 to 4.9 days for people who have lab confirmed flu, or 4 to 6 days for patients who have the flu, which are doctors confirmed. So just to give you an idea, these are the loss of the productivity. Next slide. So what can we do to prevent this? Now, the picture here, I think is interesting. But you do not have to do things like this to prevent yourself from the flu infection. Well, you may want to do it now because of COVID-19, but I guess there are simple things you can do. It is just to get the vaccines, which has been available for 80 years, has been shown to be effective and safe. So we do have a solution here. The point is, how common is this solution is picked up by the patients or by the authorities? Next slide. The World Health Organization, they say that get the vaccines if you are in one of those high-risk groups. As I mentioned to you in one of the slides earlier, the US CDC, they are leading the world in terms of the recommendation for flu vaccination. They say everyone 6 months and above, go and get the vaccines. And the 6 month cutoff is the indication for flu vaccines. For under 6 months, the vaccine is not indicated for them. They will have to rely on the maternal vaccination hoping your mothers would get the vaccines before you were born so that you can be protected before you are indicated for flu vaccines. On your right-hand side is the recommendation from Taiwan, from our region. You can see the recommendations is slightly different from the US or from the WHO, and that has been factored in the local circumstance, like the funding, availability, the budget, the local disease burden. And I guess the point here is globally and also in the country level, they all recommend the flu vaccination. Next slide. So let's take a look at a bit more details in terms of what the World Health Organization said to us. Now, the first point is strengthening the seasonal vaccination. So the vaccine you get it every year would help us to prepare the future flu pandemic vaccine introduction. Now, if you remember back to 10 years ago or 11 years ago in 2009, when we had the swine flu pandemic, we could get the vaccines in just 6 months' time. Now, compared with COVID-19 and other diseases, 6 months is a record fast. Why we could do that back to 10 years ago? Because what we did is we stopped the manufacturing for seasonal flu vaccines and used the same plant, used the same technology to produce the pandemic vaccines because they share the same platform, the same technology. So when the flu pandemic comes, we just stop the seasonal vaccine production and switched to the pandemic. So having the seasonal vaccine program each year actually will help us to prepare the next flu pandemic. The organization also highlight the fact that for younger people who think they are healthy, who think they would not get the flu or complications, like the pregnant women or young children, we need an effective educational program and communication strategies to make sure they realize how important the flu and how beneficial the vaccination. Now, in terms of the vaccine uptake target for the at-risk groups, the WHO recommends 75%. Now, of course, the higher the better, but for the higher risk, 75% would be the minimum to accept. Younger people who are healthier, they tend to have a lower uptake, but I guess for us, the higher, the better. Next slide. So let's take a look at the kind of national flu vaccination program around the world. Now, this is a national program, means that the funding is available to all the recommended population groups in the countries. So back to 2014, and this is the latest data we have from the WHO, they say 60% of the countries, they have some form of a national program. So in the map, those in the dark blue is the countries with the national program. Those in the lighter blue is the countries without national program, or we do not have a data to show they have a program. So most of them, as you can imagine, from the Africa, from the Asia, where we all are here today. So these two regions are the problematic ones when you come to the national programs for flu vaccination. Next slide. Now, let's take a look at the things in a different angle. In the previous slide, we take a look at the national program. It means that the funding is available to all the recommended groups. This slide is for any funding at all. And indeed, most of them, or actually half of them, they do not have a national program, but they have some funded campaigns in place. Like, for example, in Malaysia, they will fund the vaccines to the healthcare workers only. And some other countries, they do not have a national program, but they do have some form of the funded campaign for certain groups. So this will give you a sense that it is not perfect, and we need to improve this in our region. Next slide. So I guess this is the last concept in my talk. It's called herd immunity. Vaccine is quite unique in the sense that they protect the people who get the vaccines, but they also protect the people who do not get the vaccine, but you are a contact of the vaccinees. Unlike the pills or drugs, When you are sick, you take the pills, take the medicine, you get recovered. Your contacts, your household members do not get any benefits at all from this. But to achieve that, you need to make sure that the vaccine's uptake is sufficiently high enough to give you the herd immunity. Now, again, the herd immunity is the indirect benefits the non-vaccinees get from the vaccinees. If I can, I'll give you a bit more details in the next slide. So if you could pass on the next slide. So this is the way that I would like to explain this. On your left-hand side is how the infection is transmitted in the communities or household without any immunity, meaning no one is vaccinated, no one have the immunity from past infection. So one patient can become 2, 2 can become 4, 4 become 8. And this is how fast the disease can be transmitted without any intervention like vaccination. On your right-hand side, you can see some patients, they got a V in the middle of the circle, means that they're vaccinated. So the transmission train is stopped when someone get the vaccination and protected. You can see 2 smiling face in the orange color. You can imagine those would be the 2 vulnerable household members, like your grandparents. They do not need to get the vaccines because you are vaccinated. So the infection is not brought into the household. So they get the benefits of the herd immunity. So I guess we have a social responsibility to play here. It's not just to protect yourself, but also protect your loved ones who may be more vulnerable to the vaccinations, such as those who have medical conditions and those who are really old or those who are really young. They need you to play your part, not just for yourself, but for them. So the next slide. And this is my closing statement of my presentation. As you can see from my talk, flu is an important disease, give you the severe complications and cause society the economic loss. Despite the recommendation and funding from the public health bodies, the awareness of the disease and the uptake of the vaccines is quite low in our region. So I guess we have things to do, and I hope my talk have given you some idea about the disease and vaccination. So I will stop here, and if you have questions, I'm happy to answer them.
Can you hear me? Okay, brilliant. Thank you, Kevin. Fantastic presentation. We'll have a few minutes for some questions if people have questions. If you do have a question, if you can add it to the chat window in the bottom right of the screen, we will read it out for Kevin. We have a couple of questions that have already been submitted, so I can ask those. Kevin, if you don't mind me asking, what is the percentage of people who need to be vaccinated to achieve herd immunity?
About 2/3. So that depends on disease. For flu, we think it's about 2/3. When the whole communities are vaccinated, you can get a herd immunity. Now, the more infectious the disease is, the higher uptake you need to be. Like the measles or pertussis, you need a higher than 2/3. But for flu, 2/3 will be good enough.
Fantastic, thank you. We have a question here from Jamie. How effective is the flu vaccine when administered in terms of preventing the infection?
So that's a good question. The effectiveness of flu vaccines is different from year to year. So sometimes can be 80%, sometimes can be 10% or 20%. It's multiple factors in place, like how close the vaccine strains compare with those are circulating in the communities. Because you can see from a video I showed to you, the virus change every year. And the World Health Organization, they have a guess what will be the strains in the coming season 6 months before we get the vaccines. So there's a gap between the WHO made a guess to the time we have the vaccines. But the virus can change in these 6 months. So it's a bit of luck indeed on this. And also depends on your baseline immunity. If you have the vaccines or infections before, you are protected by the against the strains. So you may have some baseline immunity already. So it depends on the strains, whether it's matched or not, depends on the baseline immunity, and depends on how old or how young you are. So normally the younger people better respond to the vaccines. But on average, it's about 50%.
Okay, brilliant. Thank you. That's great. And we have another question here. Can herd immunity be developed without any vaccines, but solely from antibody and resistance created within the body?
If I can try to interpret the question, you're asking whether the herd immunity can be developed through the lateral infection.
Yes, I think that's
right?
the question.
Yes.
Yeah,
it can be, but again, you need to have about 60% of the people who are immune, means that you have the 60% of the people who are infected. Now, if you have a disease that is unchanged for years, I'm sure the 60% or 2/3 can be achieved. But for flu, they change every year. In one single season, we do not have that high attack rate. It's about 20% every year people get the infection. So since the virus are changing every year, we would not achieve the herd immunity threshold by lateral infection. So we need the infection. We need the vaccination here.
Brilliant. Thank you. I have a question here from Dr. Somani. Can you discuss the pros and cons of getting vaccinated twice a year at Northern and Southern in terms of efficacy and risk of immune tolerance?
Yes, it's a really good question, and I would like to discuss it in 1 hour, but I'm trying to make it in 1 minute. So at the moment, the recommendation is once per year, and that's how the vaccine is developed and how the vaccines are recommended or indicated for. Now, we do know the vaccines do not last forever. And indeed, the peak level of the immunity or effectiveness only lasts for 3 to 4 months. So you may ask, for those who are high risk, those who are traveling, we can't do it now, but after the COVID-19, you may want to travel to a place where you have the winter. For the high-risk groups, you may want to discuss with your doctor to take a look at the risks and benefits, whether you need a second dose. But I would stress that this would be based on your individual assessment, whether you have the vaccine before and how earlier you get the vaccines. Because if you get the 2 doses in too short, like less than 4 months, actually we have this kind of called immune blunting, means that immunity is not increased by having a second dose, it's a decrease. So the gap between the 2 doses and your individual risk profile is important to determine the need for second dose. So you need to talk to your doctor to take a look at your personal circumstance.
Brilliant, thank you. We have a couple more questions, if you don't mind. How do we cope with the antigenic shift and the drift of flu virus since vaccination to a large population? And does it pose a question of feasibility?
Then could you repeat the question to try to guess what's the?
Sure. So I think the question is centered around antigenic shift and the drift of the virus itself within a large population. Does that pose a question of vaccine feasibility? So with the sort of antigenic shift and the drift of the virus, is it a challenge from a vaccine feasibility perspective?
Okay, let me try to answer this. So the shift means that it's a big change, and it means that they can cause the global pandemic. So the last shift for flu virus we have seen is back to 11 years ago, the swine flu pandemic, when they have a very, very big change in the virus. We call this shift, and we have the pandemic vaccines, pandemic for flu, and we need to develop the pandemic flu vaccines for it. For drift, it's a different concept. It's a smaller change, and that's a change we have almost every year. And that's why we need to update our vaccine component each year to match the drift virus. And I guess that's the reason we need to have the annual vaccination, because the virus keep changing, the drift. And that's why we need to update the vaccine to catch that. This is much, I would say the drift is much more frequent than the shift.
Thank you. And we actually have a related question in terms of influenza vaccines. What is being done to improve effectiveness and cost effectiveness? And what are some of the current vaccine technologies that are currently available?
Oh, yes. As I told you that this is 80 years old vaccines, I'm pretty sure it's older than any one of us. So over time, we do have an improvement in terms of the technology. We did this by, firstly, we increase the number of the virus in the vaccines first. So we start from a single virus vaccines, and then and then we have 2 viruses. Recent years we have 3, and then in the last decade we have 4. So we're increasing the number of viruses to hoping to increase the coverage of the viruses. That's one thing in terms of the vaccine components. The second thing, we do have a kind of innovation in terms of the vaccine technology. The ones that we have in Singapore and many parts of the Asia is the standard inactivated egg-based vaccines. But if you take the US or UK or sometimes Australia, they actually already have what we call the newer generation of the seasonal flu vaccines. Some of them, they use a higher dose, means that you increase the concentration of the active ingredient in the vaccines, hoping that give you a better immune response. And the elderly group, actually, they need a higher concentration. So higher dose is one option. The other philosophy is using the adjuvants. It's a chemical which boosts your immune response. Now, there are multiple adjuvants for different vaccines, but for flu vaccines, we have the adjuvant called MF59, and that vaccine is available in the US and UK. A third option is what we call the recombinant. So they, other than using the egg-based technology, they use other platform to grow the virus, which are more stable than the egg-grown virus. So those vaccines is not available here. At the moment, it's only available in the United States. So we are doing more, and I can see that Sanofi and other vaccine manufacturers, they are trying to bring the newer generation of the vaccine to Asia. Those vaccines are, most of them, they are more effective than what we have now.
Brilliant. Thank you, Kevin. Now we are, unfortunately, we've had a lot of questions coming in, lots of interest in this talk and your points. So thank you. In order to keep the flow and to keep to time during this session, what we'll do is we'll collate the questions that you've submitted, and if you're okay, Kevin, we'll catch up afterwards. We'll make sure the questions are answered in a separate session, so that we can ensure these fantastic points. Thank you, Kevin. Really appreciate that and your thoughts. And now we'll move on to the next session.